I think it's important to understand now that the front line of the NHS has changed and that technology and digital products and services are at the forefront of that.
We handle the management of patient data, we handle electronic prescriptions, we handle medical records. Basically anything connected to your healthcare is connected to NHS Digital.
I really wanted a career that would make a difference and help people, and I felt that I could best do that at NHS Digital. With the COVID pandemic, digital services are crucial now more than ever, so I felt this is really the place I needed to be.
I think what most surprised me working here was the complexity of the problems, but also the autonomy you get to solve those problems. There is a lot of freedom here to kind of take those problems head on yourself and work with multidisciplinary teams to tackle those ideas.
So as a business, we're committed to building and developing our early talent, particularly in data-driven and technical areas, to future-proof the national healthcare system.
During my time here, I've been pushed to develop both technically and professionally. So for example, I've been on a 4-day out-of-company Python training course. A lot of the training happens on the job as well. You get given a data set, for example, and you have that freedom to use different coding languages and what you know, but also you're pushed to develop what you don't know.
It's really easy to trace the work you do to a pretty sizable impact to patients' lives. The most obvious example is if you work on something like cervical screening. I was working on creating a replacement system for the one currently in place that manages the recording and transportation of people's cervical screening results.
So I think graduates can have a really valuable impact here at NHS Digital. We're kind of the first digital natives that can bring the new learning, the new way of doing things, the new technologies to a well-established organisation.
I'm an ethnic minority and I'm a woman as well, and I feel like there's a lot of barriers when it comes to a workplace. But I think within NHS Digital, there's such a diverse range of people, the communities and the networks that are already established.
You're in an environment where you have every ability to succeed, but also you have the ability to fail as well and learn by failing.
We are using technology to actually make people's lives better. It's very much just people driven.
Everything you work on, you always have in the back of your mind, how does this relate to the patient? How does this improve someone's lives? It really just gives you a bit of a buzz for coming into work every day.
As an organisation, as NHS Digital, we are uniquely positioned to hone our passions to save lives.
The work that we are doing has a direct impact on people's lives. That is enough motivation for me to kind of keep giving it my all and make sure that I'm doing what I can do to the best of my ability, but also making sure that whatever the user need is and whatever the patient needs, whatever the GP needs, whatever the dentist needs, whoever it may be, that their problem is getting solved.